So what is it? It is a disorder in which nerve cell activity in the brain is disturbed, which causes seizures. And a seizure is a burst of electrical energy or activity in your brain and the disruption of electrical communication between neurons. Some symptoms and assessments. You could experience abnormal behavior, loss of consciousness, fainting, fatigue, muscle spasms, headache, sleepiness, and staring spells. And this just kind of shows, it's like a little information. There could be confusion, staring like mentioned before, falling, all of a sudden uncontrollable jerking movements, strange sensations and emotions, and then lots of awareness or consciousness. Causes and risk factors. Head trauma, which could be a result from a car accident. Genetic influence, which means it can run in your family. Brain conditions, brain tumors and strokes. Infectious diseases like meningitis and AIDS. Prenatal injury, which is infection of the mother, and poor nutrition can cause epilepsy. And then part 2 are developmental disorders, such as autism could be associated with it. Stroke and other vascular diseases, which can trigger brain damage that may trigger epilepsy. And then dementia can increase the risk of epilepsy in older adults, and then brain infection. And then this is just another picture. Another thing they mention is alcoholism or alcohol withdrawal as another part. Diagnosis is a neurological exam, a blood test, CT scan, MRI, or functional MRI. And then when you get your test results, your doctor may want to use a combination of analysis techniques to help pinpoint when the seizures start. So they can do an SPM, which is a statistical parametric mapping, and it compares areas of the brain that have increased metabolism during seizures to what a normal brain would be, which can give doctors an idea of when the seizures start. There's a Curie analysis, which takes EEG data and projects it onto an MRI of the brain to show doctors where they are occurring or where the seizures are occurring. And then there's a magnetosynophrography, MEG, and it measures the magnetic fields produced by brain activity to identify where seizures could be onset. And then this is just kind of where it happens, what brain activity will start to look like. And then treatment, you can do medication, surgery, or therapies. Apart from the medication, the surgery, the therapies, there's vagus nerve stimulation, where the doctors implant a device called a vagus nerve stimulator underneath the skin of your chest, and it's kind of like a heart pacemaker. And then the wires are connected to the vagus nerve in your neck, and the battery-powered device sends bursts of electrical energy through the nerve into your brain. And they don't entirely know how it inhibits seizures, but it can reduce them by 20 to 40%. And then there's also a ketogenic diet, and it's mainly in kids. They've been found to reduce seizures by like a stricter diet that's high in fats and low in carbs. And then deep brain stimulation, which is implanting electrodes into a particular region of your brain, generally your thalamus, and the electrodes are connected to a generator implanted in your chest or your skull, and they send electrical impulses. For prognosis and follow-up, there is a risk of premature death, and it is up to 3 times higher. If you don't have access to the resources you need and the necessary medications, your condition will be worse. Up to 70% of people living with epilepsy could live seizure-free if treated properly. 1 in 50 people will have epilepsy at some point in their life. And follow-ups with your doctor are needed, and best to try to avoid triggers such as alcohol. And that's our source.